Hello, my friends. This is Dr. B, the best doctor in medicine. 30 plus years of experience in medicine. Dr. B knows it all. Today, my friends, Dr. B wants to talk to all of you who are 50 or above, like me. Dr. B just turned 50 years young. 50 years young. If you are a man or a woman or anything in between, and you are at least 50 years young, 50 years old, whatever, please make sure that you have a yearly, at least once a year, a pancreatic cancer screening ultrasound examination. Very, very, very important topic. So listen again. If you are a man or a woman or anything in between, and you are at least 50 years old, any age, 60, 70, 55, 51, 80, doesn't matter, please make sure that you have at least once a year a pancreatic cancer screening ultrasound examination. And I'm explaining to you why. Pancreatic cancer, the cancer of the pancreas, right? This organ deep behind your stomach, in the top here, behind your stomach, right? Is the number four cancer killer in the United States and now the world, right? In any Western country, pancreatic cancer is or soon to be the cancer killer number 4. Remember, I talked to you in another video, the cancer killer number 1 is of course lung cancer in men and women. And then in men, the number 2 cancer killer is prostate cancer, which competes with colorectal cancers. In women, the number 2 cancer killer is breast cancer, which competes also for that position with colorectal cancer. Number 3 cancer killer is colorectal cancer, even though in some population is at number 2 in men and women. And number 4 cancer killer in the US and in Western world now is pancreatic cancer. Isn't that crazy? And it's happening in younger and younger and younger people, right? So pancreatic cancer, guys, think about that. It used to affect people in their 70s, whether man or woman, right? People in their 70s, 80s. Now more and more young people, right? Starting around the age of 50. 50 is nothing. Dr. B is 50 years young, right? People at my age and above, in their 50s, in their 60s, starting to be diagnosed at an early age with pancreatic cancer. It's a deadly cancer. It's the worst cancer you can have, right? The problem is that the pancreas is very deep organ. It's a small organ and it's deep behind the stomach, in the top of your tummy, just in front of your spine. So it's pretty deep, right? So obviously your family doctor, your internist, is not going to screen for it, right? He's not going to detect it by palpation, right? And 99% of people who are diagnosed with pancreatic cancer are diagnosed at a stage when the cancer has already spread out of the gland. Means it's a stage 2 or 3 or 4. Huge amount of people who are diagnosed with pancreatic cancer, it's over. They are already stage 3 or 4. Even chemotherapy doesn't work. Their survival rate is just a few months. They just have the time to write their will and last testament and, travel around the world and spend their money, but they're so sick they can't even do that. After a few months, they're dead. Now, remember, your family doctor is not going to screen for that because there are no official guidelines, right? The government, the health department of your state or the federal system, they don't do guidelines for pancreatic cancer screening, right? They haven't issued any, right? So you, as a man and a woman or anything in between, who is 50 or above, you need to have at least one time per year an ultrasound exam. It takes 5 minutes, 10 minutes to do, with the ultrasound probe put on your tummy, on top of your tummy, and to look at the pancreas, get the picture, and make sure you don't have a cancer, right? Now, the problem is that the insurance companies are not going to cover it, right? It's not going to happen. The government is not going to cover it. Medicare is not going to cover it. Medicaid is not going to cover it because it's not part of the regular screenings, even though, think about that, even though it's the cancer killer number 4, and even though it's happening in younger and younger and younger people, right? So they're not going to do it. They're not going to cover it. They're not going to, your doctor not going to talk to you about it, blah, 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 blah. Guys, remember that you need to be in charge of your own health care, right? After a certain age. We're not kids anymore. We're not young adults anymore. Once you reach 50 and above, you need to take matters in your own hands. You need to not rely, like the good old days, on your doctor and think that this guy is the God who will do everything for you. He will screen you for everything and blah, blah, blah. Your doctor, whether at the clinic or at the hospital, is busy making money. He has 40 patients to see in one day. He is busy running a business, right? Medicine in the US is a business to make money, right? So your doctor, he's going to quickly in and out. Each time you're going to see him, it's going to take 5 or 6 minutes. You're going to be in and out of his clinic immediately, right? Within a few minutes. The average time a patient spends in the doctor's office is 5 to 7 minutes, according to the American Medical Association, right? So your doctor is busy. Your doctor doesn't care. Your doctor follows the guidelines of the health department, right? Right, of the CDC and all these medical organizations, which haven't issued yet an official guideline for screening of pancreatic cancer, right? But Dr. B is here to help you age gracefully, reach retirement age with none of these cancer diseases and chronic disease and heart attack and heart failure and chronic kidney disease and kidney failure and liver failure and dementia, neurodegenerative diseases and all these creepy, crazy diseases, right? So listen to me. Do not take any chance. If you are a man or a woman and at least 50 years old, you must, next time you see your family doctor, to send you to that imaging department, radiology department, for an exclusively pancreatic cancer screening ultrasound examination. If you don't specifically ask for that, your doctor gonna send you for an abdominal ultrasound. So the ultrasound technologist is going to spend half an hour or 20 minutes, 15 minutes looking at your liver, kidney, and viscera, and blah, blah, blah. And when it comes to the pancreas, he or she is going to say, I couldn't see the pancreas because of gas. And that's what they will always do to quickly finish the exam, get you out of the room, in and out, right? I have a brother who lives in Toronto, Canada, right? His doctor sent him for an abdominal ultrasound, right? Instead of sending him for a pancreatic cancer screening ultrasound, he sent him for an abdominal ultrasound. He told me after 5 minutes he was out of the room. The ultrasound technologist quickly got his pictures, right? And then when I told him, send me the report of your exam, it was written like always. We were unable to see the pancreas because of bowel gas. The patient was gassy. It's an excuse that they always bring so that they don't take time, because you have different techniques that you can use to see the pancreas if it is hard to see. But the ultrasound technologies, in cahoot with the radiologist, in order to see more patients and make more money and go faster in the examination, in and out, right? They will always tell in the report, we couldn't see the pancreas, right? And your doctor, of course, who doesn't understand anything about ultrasound because he's a family doctor and internist, gonna look at the report and say, oh, okay, abdominal ultrasound was normal and they couldn't see the pancreas, who cares, right? And you're 60 years old, right? And the incidence of pancreatic cancer, I mean, look around and look at the news, right? Every freaking day you see an actor, an actress, a celebrity, a rich person, this, that poor person being diagnosed with pancreatic cancer, right? You hear only about the famous people, but the millions of people who are not famous like me and you don't hear from them, right? When something happens. And guys, as I said, your insurance company is not going to cover it. Why? Because the insurance companies will cover it only if it's an official screening test and the guidelines have been given to doctors and blah, 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 blah. Remember, guys, the bureaucrats at the health department in your state or in Washington, they don't care about you. The freaking bureaucrats who make millions of dollars sitting in Washington or in the state, in the capital city of your state, right? I live in California. They don't care about me and you, right? They're politicians, right? They will do anything that will get them reelected. They don't care about your pancreas. They don't care about my pancreas, right? So they're not going to cover it. In addition to that, the government is bankrupt, right? The federal government is bankrupt, right? We have $37 trillion of national debt. National debt, 37 trillion, not million, not billion, $trillion. The states are bankrupt. I live in California, right? The state of California has a massive, multi-billion dollars of budget deficit. So do you think that the state of California gonna give good health care, high quality health care, high quality access to health care to the 45, almost 50 million Californians? Do you really believe that? We are somewhere, I think, between 45 and 50 million people in California. I forgot the exact number. Let's say 48 million, right? 48 million Californians, right? Do you really believe that the state of California has money to give good, beautiful, state-of-the-art prevention, medication, surgeries, medical checkups, and medical treatments to these 48 million people? Of course not. The state is bankrupt. The state of California has hundreds of millions of dollars of budget deficit. They can't even pay the pensions. They can't even pave the roads. There are potholes everywhere. They can't even take care of mentally sick people. Mental care is a disaster in California. They can't even take care of all these homeless people. They can't even take care of all these crimes, rampant crimes all over the place. Homeless people in every city, sleeping under the bridges, in the parks and everything, right? The state of California is bankrupt, right? So you, whichever the state you live in, whatever your gender is, male, female, or anything in between, if you are at or above the age of 50, you will have to pay for your own, one time per year, pancreatic cancer ultrasound exam. It's not expensive, right? It's going to be $100, $120, $150, right? So you have to tell your doctor you want that exam. You request it from your family doctor. Otherwise, he's not going to do it. You have to insist. Otherwise, he's not going to do it. And then you tell him you will pay cash. So he will not involve insurance, right? Because you will be denied. And then when he asks you to call, or his secretary going to call that imaging department, that radiology department, private radiology department, right? Don't go to hospital. They will not do that. Go to a private, tell your doctor to refer you to a private clinic, radiology clinic, ultrasound clinic, right? Dr. B is an expert in ultrasound, 14 licenses in medical ultrasound, the record in the US. I'm an expert in every field of ultrasound. I know ultrasound better than my own penis, right? If I may, I apologize. Right? But to tell you how much I'm an expert in ultrasound, right? And medicine, of course. So you have to ask your doctor to send you to a private clinic. Then you contact the clinic. You make sure that they know that you are going in to be cash pay. And then you ask them if they can give you a discount because you're going to be cash pay. At the most, you're going to pay $150, which, believe me, it's a beautiful investment, 1 4 year in your health. You invest in your savings accounts and 401ks and blah, 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 in your stock market, blah, blah, blah. You need to invest in your health the same way you invest in your house, in the stock market, in your savings accounts, in your CDs and everything, right? And believe me, it is all worth it, because we're talking about pancreatic cancer. If you get it, then it will be too late by the time it's discovered, right? It's too late. You're dead in a few months, right? By the age of 55, 50, 60, it's just not worth it, right? So don't be among those people who say, oh my God, $100. But my God, my family members, it's crazy. They go sit down at a restaurant. The guy pays $200 feeding himself, his wife and kids. $200 one time in a restaurant with the tip and everything, $250, with the wine $300. And then, whoa, look at that, Dr. B. They want me to pay $150 for my ultrasound screening. That's too much. The insurance doesn't cover it. Blah, 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 blah. Yeah, the insurance is not going to cover it. The government, the federal government is bankrupt. The state government is bankrupt. And nobody cares about your health, right? Except Dr. B. That's why Dr. B is here. Because Dr. B genuinely loves you. Dr. B genuinely cares about you. Dr. B is not here to sell you any fake stuff, to sell you any BS, to make you buy any fake stuff, to make you buy all these miracle medication, miracle treatment, BS. Dr. B is here genuinely because he cares about you. He wants to transfer his massive knowledge, right, and skills in an easy to understand way for you to grow healthy, to age gracefully. You know what I'm saying? So instead of going 5 times in a month or 6 times in a month to a restaurant with your family, just go 1 time less and put that money aside and pay for your 1 time per year ultrasound examination to screen you for pancreatic cancer. And remember, if you are 60 years and above, and you can afford it, do it 2 times per year. 2 times. Because as you reach 60 and above, your risk is way higher than when you were 50 and above. Once you reach 70 and above, your risk is even higher. So anyone, whether you're a man or a woman or anything in between, and you are 60 and above and you can afford it, then do it 2 times per year so that cancer can be detected even earlier at stage 1, when it is still confined to the gland, to the pancreas, and hasn't spread out. Because once it spreads out, that's it, it's done. Your life expectancy for stage 2 is just 2 or 3 years. For stage 3 and 4 is just a few months. You're dead. That's it. You're gone. So, and then you're going to say, my God, how come I didn't listen to Dr. B? I should have paid for that $150 one time or two times per year and have my ultrasound, right? Last but not least, when you have your appointment with that imaging department, right? The night before, do not eat anything, right? No dinner, nothing. Just tea. That's it, and you go to bed. If your appointment is in the afternoon, not only the night before, but in the morning, don't eat anything. Nothing. Tea, you can have a tea, you can have a little milk, you can have coffee, you can have beverages, you can have an apple juice to give you energy, right? But do not eat solid food, right? Because if you eat solid food, the food will be in your stomach, as I told you earlier in the video. Your pancreas is behind your stomach. So the ultrasound technologist who's going to take the probe is going to put it on your tummy, and all he's going to see is the food in your stomach. And the food is in your stomach are not going to allow him or her to see your pancreas in the back of your stomach. Do you understand? So, once you get your appointment for your ultrasound exam, if it's in the morning, the night before, do not have anything, no solid food at all, nothing. Plain orange juice, a little bit of tea if you want. Why not? Tea, beverages, water, milk, why not? But no solid stuff. That's the worst. And if your appointment is in the afternoon, in addition to that, no breakfast. So don't have any breakfast, do not have any dinner. Regardless of your appointment in the morning or in the afternoon, on a given day, the night before and the morning when you wake up, do not have any breakfast, don't have any lunch, don't have any solid food before you go for your ultrasound exam, because the ultrasound technologist will not be able to see your pancreas, which is behind your stomach, because of all this food that is in your stomach, right? And last but not least, as soon as you go into the exam room, means the person who is the ultrasound technologist taking you in that room, asking you to remove your shirt so that they can, and then lay down on that exam table so that he or she can perform the ultrasound exam. Have 2 bottles of this. You see this water? I'm not advertising anything. This is half a liter, right? Half a liter of food, right? What you need to drink is 2 of these. Make it 1 liter, half a liter, which is about 1 pint, right? So you need to have about 2 pints, which is 1 liter. 2 pints, 1 liter. So 2 bottles like this of water. Make sure it's not cold. It has to be kind of body temperature, right? And you quickly, immediately, before you lay down on that table, swallow those 2 bottles. Those 2 bottles of water are going to fill up your stomach with water. Oh my God. As the ultrasound technologist takes the probe and puts it on top of your tummy, right? Not only your stomach will be empty of any food, in addition, your stomach will be full of this water that you just drank immediately before laying down. Oh my God, your pancreas will be visible so beautifully, so nicely, right? And then the ultrasound technologist will take the picture. It will take 5 minutes, maybe 10 minutes, right? At most. And that's it, you're done, right? And then you're done. That's it. Then see you next year, right? And again, if you are 60 or above, try to have it twice a year by paying it yourself again, right? So please make sure that you do not forget to ask your family doctor, your general practitioner, your internist, that, hey, doctor, I'm 50 years and above, and I want to have an ultrasound screening for pancreatic cancer, and make sure he doesn't send you for an abdominal ultrasound, because in the abdominal ultrasound they're going to do everything else, check your liver and kidneys and blah blah blah, and they're going to skip that pancreas, and you're going to waste your money, right? Make sure you are self-paid. They can give you a discount at that imaging department, and don't dream that insurance is going to cover it. It's just not going to happen, right? Guys, do not neglect pancreatic cancer, right? The same way you don't neglect prostate cancer, you go urologist to check your prostate, right? The same way, woman, you don't neglect breast cancer. The same way, guys, we examine our skins. Woman, we examine our skin for melanoma, for skin cancer, blah blah blah. I gave you a video about how to check yourself for rectal cancer, blah blah blah. We check our mouth at the dentist or ourselves in front of the mirror for oral cancer, right? There are some cancer you can detect yourself at a very 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 early stage, right? And that's one of them, pancreatic cancer. Do not be like Steve Jobs. Guys, do you remember the billionaire? The billionaire Steve Jobs in his 60s. He got pancreatic cancer. Think about that. This guy was a billionaire, right? He was so busy making more billions. Like, he doesn't have enough billions. I need to make more billions. He had so many billions of dollars, he wanted to make more billions. So much that he forgot about his own health care. I'm sure he had a doctor, right, who was checking him for his prostate and cholesterol, diabetes, blood pressure, blah, blah, blah. But his doctor never, ever, because the doctor is just, I don't know, I don't want to be mean to some doctors, but they don't care. They care only about the money. They follow like a donkey the guidelines, right? We call them book doctors. I mean, they don't look this way. They don't think. They don't use their brain's processing power. They just read the book and they go by the guidelines of the American Medical Association, and they don't go beyond that, right? They don't go beyond that. So his doctor never came and told him, you know what? Every year I'm going to make you 2 times an ultrasound exam just for your pancreas. Imagine Steve Jobs, the billionaire, right? He could have bought the entire imaging clinic. He could have bought the clinic of any doctor, right? He could have bought them all with all his billions, but he didn't do it. He didn't care, and he trusted his doctor, and his doctor, of course, didn't tell him that. Otherwise, they would have found his pancreatic cancer way before it spread to his liver. The poor guy, Steve Jobs, with all his billions, by the time they found his pancreatic cancer, it had become a stage 4, and it had spread to his liver. That's it. He was done, right? But he was able to pay Stanford University millions of dollars to put him on a so-called liver transplant, which is of course forbidden if it happens to me and you, right? But because he was a billionaire, he gave a big billions of dollars to donation to Stanford University, which performed unethically. It was completely unethical, right? But they did it because he's a billionaire, and that's Steve Jobs, and he's the God, and me and you are nobody, right? But Steve Jobs is the God. So we need to treat Steve Jobs differently than how we treat me and you, right? So they performed at stage 4 of pancreatic cancer a liver transplant at that guy, right? To remove the liver that had the cancer and put a healthy liver. Eventually, even that didn't make it, and he died of massive extension of his cancer, right? May he rest in peace, right? He didn't enjoy his billions, that's for sure. So don't be like Steve Jobs. Listen to Dr. B. $100, $150, one time or two times per year will help you age gracefully. Stay away from cancer, from these nasty cancers, and especially pancreatic cancer, cancer number 4, and growing, so that God willing, I can still be with you and you can still watch me in 40 years from now, 50 years from now. In 50 years, I will be 100 years young, and God willing, I will keep doing medicine, because I will never retire from medicine. It's just not going to happen. I will keep talking to you and taking care of your health, and I will keep doing medicine at the cardiovascular clinic where I work every day, and I love it. And God willing, we will age together gracefully. You will still be my student, and I will still be your teacher. I love it. You guys remind me of the good old days when I used to teach to medical students, nursing students, ultrasound students, x-ray students, and I had to give up teaching because I'm so busy with the clinic and everything. But now you are my students, and I have found again my classroom. Google has become my classroom, and I know there's hundreds of you watching me. May God bless you, regardless of your gender, ethnicity, blah, 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 blah. I'm a doctor. I love you, and I hope to talk to you in the next video. Get back to me if you have any questions, any comments, or anything. It might take time for me to get back to you, but I promise I will do it. May God bless you all. I love you. Bye-bye.